Hi everyone, this is Mr. Neil Wrighter, consultant audiologist and director of WAXscope. Thank you for joining me in another demonstration video of our recently developed WAXscope, which is due to be launched in early autumn 2022. And if you are a clinical ear care specialist or wanting to become a clinical ear care specialist and are interested in the WAXscope, please do send an email to us at info@clearwax.co.uk and we can add you to our mailing list. And you'll then be kept up to date and up to speed with the release date and other information such as pricing for the WAXscope. So we have a patient here who attended with bilateral, fully occluding, very thick, dense, glutinous earwax, and it's adhered itself to the canal walls, and the canal is actually somewhat engulfed itself around this plug. Now I'm using the 4.25mm speculum. This is probably going to be the most commonly used specula, but we do have a smaller size, a 3.5mm, and two larger sizes, a 5mm, and also a 5.75, which is probably going to be used more for your mastoid cavities, etc. So you can see I've just put some olive oil spray in here just to loosen this plug of wax, but you can see there's a thick layer of keratin. And once I remove this plug, you'll see just how thick this layer is, and we've also got some still images. So this keratin is not only enveloped itself around the plug of wax, but it's also still attached to the ear canal wall. So we're just trying to detach and mobilise this plug. And I'm just going around slowly the perimeter of the ear canal, just trying to loosen and tussle this plug outwards. So you can see there it is more or less mobilised. But I'm just going to the posterior canal wall. So this is the patient's left ear. You can see that fresh layer of skin. It's just died and shedded a little bit. It's attached to itself. And just to the left, you can see the second bend. And this plug is trapped around that second bend. So I'm just going to the posterior canal wall, just trying to bring this in. This is where I mentioned earlier, the canal itself has engulfed itself around the wax plug, and the patient had been using cotton buds, so the canal's slightly inflamed. And now I'm just going to the roof. I'm just trying to bring this downwards, but the consistency doesn't help. It's really thick and dense, as I mentioned earlier, and that type of wax is very hard to suction. So that's where the oil really helps. And you can see I'm just using the speculum to dilate the ear canal, and I'm just focusing here at the roof of the ear canal, just trying to see if I can bring this forwards and downwards past that second bend where it's trapped. But it's just too dense and thick, so I'm just going to the bottom again, or to the middle, and I'm just now wriggling this. I'm just trying to tussle this, bring this forwards, and I'm just squeezing it through. I can feel it coming forwards. Again, I'm going to just elevate this upwards to completely detach it if there's any more skin adhesions further deep in there that I'm not able to visualize at the moment. You can see this plug's more or less mobilised now. And as I'm moving it side to side in a little concentric circles, I'm trying to also bring the suction probe outwards towards the entrance. I'm trying to bring this forwards. You can see it's just the suction probe has made an indentation and has imprinted itself within the core of the wax there, and that's due to the texture. So I've just gone back to the roof of the ear canal, trying to bring this down and forwards. And then to the back part, I'm trying to just curl this around the second bend, because it is large behind the second bend. And I think this is where I've now had to use the Jobson Horne. So I could possibly be going on all day trying to remove this with suction, and it's just not going to lodge. And this is where the WAXscope's really, really advantageous, because you can use all ENT microscopes. I just got in at the roof, there's an opening there, and I'm slowly now bringing the Jobson outwards, and as I am, the wax plug is coming with it. And if you watch till the end of the video, you'll see just how large these plugs were. Just going to go back in, you can visualise the eardrum. We're just adjusting the focus. You can see how easy and quick that was. You can just see how stunning that view is of the eardrum. You can see the capillaries, the blood vessels, so it's nice and healthy. You can see just in the distance where the isthmus is, there's a thick layer of dead skin there, and that was what was holding this wax plug in the ear. So just laterally, just going to go back in, just very quickly, just suction this residual wax and skin off the canal wall. And then we're now going to move on to the patient's right ear. So again, it's very dense and thick. I just went in with the suction probe just to see if I need to put any drops, and again, I needed to use drops. And similarly to the patient's right ear, eventually I removed this plug using the Jobson Horne. And you can see this thick layer of skin that's attached itself to the underside of the wax plug and also to the ear canal. So we've just put some drops in. And I've just got a good suction grip here, and I'm just going to come forwards with it. So when we're removing the wax plug, you have to navigate the architecture of the ear, so the first and second bend. So the second bend's just to the right. It may come in view, but we've stretched this and straightened the ear using the speculum, so it should be a bit easier to extract. It's more of a straight line because we have dilated it. And just to the left now, you can see the first bend, because in order to remove this plug, I have to extract this the specular. So I've just dilated the ear once more, and I'm going to use the Jobson Horne. So I'm going to glide it into the opening at the roof. I'm going to get in and behind this plug, and I'm going to bring it forwards. And as I am, I'm going to come out with the specular. As you can see, it's a tight squeeze here at the entrance, but we've got through. And then this is the patient's eardrum. So it just shows you the importance of being able to use all instruments and being trained with using all instruments. So that's the patient's eardrum. We've got a good view there. And they're the plugs. You can just see how large these plugs were in comparison. So I've put a pencil tip there for some perspective. The one on the right, that's for the left ear, the first ear. So I hope you enjoyed that video. And once again, if you are interested in our WAXscope or also the iClearScope, please do email info@clearwax.co.uk.